Picture this. You wake up with a scratchy throat, your head pounds, your nose runs. In our modern world, you might grab some medicine, drink fluids, maybe call in sick. But imagine if that same scratchy throat could be your death sentence. Imagine if the cure your doctor prescribed was more likely to kill you than heal you. Welcome to medieval Europe, where medicine wasn't healing, it was surviving, where a simple fever could mean divine punishment, and where your local barber was also your surgeon. For over 1,000 years, from roughly 500 to 1500 AD, this was reality for millions of people. Today, we're pulling back the veil on one of history's most brutal chapters. Medieval healthcare. We're going to explore a world where superstition trumped science, where pain was inevitable, and where hope was often all people had left. This is about real people who lived, suffered, and somehow persevered through medical practices that would horrify us today. What you're about to hear isn't pleasant, but it's the raw, unvarnished truth about what healthcare looked like when humanity was fumbling in the dark, desperately trying to understand the human body with nothing but fear, faith, and fatal ignorance as their guides. To understand medieval medicine, you have to forget everything you know about the human body. Forget germs, forget viruses, forget the scientific method. Instead, imagine a world built on a theory that would sound absurd today. The idea that your health depended entirely on 4 bodily fluids. This was humorism, the cornerstone of medieval medical theory. According to this ancient Greek concept, your body contained 4 humors: blood, phlegm, yellow bile, and black bile. Too much blood made you overly indulgent, lustful, and gluttonous. Excess phlegm made you cold and sluggish. Yellow bile caused anger and irritability. Black bile led to melancholy and depression. Disease wasn't caused by infection, it was caused by an imbalance of these mystical fluids. Doctors didn't examine patients the way we understand it. Instead, they studied urine color, checked the stars, and made diagnoses based on which humor seemed out of whack. The cure was always about restoring balance, regardless of what was actually wrong with you. But humorism was just the beginning. Medieval medicine was deeply intertwined with religion and superstition. Many believed that illness was divine punishment for sin. If you were sick, you must have done something to anger God. The cure? Prayer, pilgrimage, and penance. Practical medical care often took a backseat to spiritual healing. Demonic possession was considered a legitimate medical diagnosis. Seizures, mental illness, even severe headaches could be attributed to evil spirits inhabiting the body. The treatment wasn't medicine, it was exorcism. Priests, not doctors, were often the primary healthcare providers. Beyond exorcism, those who displayed signs of madness faced even darker fates. People with erratic behavior, severe melancholy, or violent outbursts were locked away in dark cellars or attics. Some were beaten regularly, the twisted logic being that physical pain would drive out demons or shock them back to sanity. And then there was astrology. Medieval physicians genuinely believed that the position of planets and stars directly influenced health and healing. They consulted astrological charts before making diagnoses or performing procedures. The phase of the moon could determine when to perform surgery or administer medicine. Your zodiac sign influenced which parts of your body were most vulnerable to disease. Folk remedies filled the gaps where formal medicine failed, which was often. People turned to bizarre concoctions: powdered unicorn horn for poison, ground pearls for eye problems, human skull moss for epilepsy. Desperate families would try anything: amulets made from animal parts, herbal mixtures based on ancient superstitions, or rituals passed down through generations. This wasn't just ignorance, this was humanity's best attempt to make sense of suffering they couldn't understand or control. Now, we enter the truly horrifying realm of medieval surgery and medical procedures. Forget everything you know about sterile operating rooms, anesthesia, and trained surgeons. Medieval surgery was brutal, dangerous, and performed by people who often had no formal medical training whatsoever. Meet the barber-surgeon, your local haircutter, who also happened to be the person you'd turn to when you needed a tooth pulled, a limb amputated, or a tumor removed. These weren't highly educated physicians. They were craftsmen who learned through apprenticeships, working with crude tools and no understanding of infection or proper wound care. Picture a typical surgical procedure. No pain relief, no sterilization, no antibiotics. Patients were held down by assistants while the barber surgeon went to work with instruments that were used for multiple patients without cleaning. The mortality rate was staggering, not from the original condition, but from the cure itself. Tooth extraction was common and agonizing. Without Novocaine or any form of anesthesia, patients endured having teeth yanked out with primitive pliers while fully conscious. Many died from resulting infections. Others simply bled to death. Amputations were performed with saws and knives, often on kitchen tables or in barbershops. Patients bit down on leather straps or wooden sticks to manage the pain. The lucky ones passed out from shock. Wounds were cauterized with red-hot irons. Imagine the sizzle and smell of burning flesh. Survival rates were dismal. But perhaps nothing was more terrifying than trepanation, the practice of drilling holes into living skulls. Medieval practitioners believed this would release evil spirits, relieve pressure, or cure headaches and mental illness. Using crude drill-like tools, they would bore through the skull bone while the patient remained conscious. Archaeological evidence shows that some people survived multiple trepanations, their skulls bearing witness to repeated attempts at this barbaric procedure. Bloodletting was considered a cure-all. Doctors used lancets to cut open veins, allowing blood to flow freely into bowls. They also used leeches, applying dozens of the creatures to suck blood from various body parts. The theory was that draining excess blood would restore humoral balance. In reality, it often left patients weak, anemic, and vulnerable to infection. These weren't sadistic practices, they were genuine attempts at healing. But without understanding of anatomy, infection, or pain management, medieval surgery was essentially sanctioned torture with good intentions. Now, let's turn to an experience that was perhaps the most dangerous medical event in medieval life: childbirth. The statistics alone are horrifying. Roughly 1 in 3 women died from childbirth-related complications during their lifetime, and infant mortality reached 30 to 50% before age 5. When complications arose, the outcome was usually fatal. Midwives used desperate measures, violently shaking the mother to dislodge a stuck baby, administering toxic herbal mixtures to speed labor. Caesarean sections existed, but only to extract a baby from a dying or dead mother. The mother never survived. The procedure was performed to save the child or allow baptism, not to save her life. Even surviving birth didn't guarantee safety. Childbed fever killed countless new mothers in the days following delivery. With no concept of hygiene, midwives moved from patient to patient without washing their hands, spreading deadly infections. Every pregnancy was a genuine life or death gamble, and women faced this risk repeatedly throughout their reproductive years. Medieval society had brutal methods for dealing with contagious disease, methods that reveal as much about their medical ignorance as their capacity for cruelty. Anyone with visible chronic diseases, severe skin conditions, mysterious ailments, disfiguring illnesses, faced social exile. Families who couldn't afford to isolate their relatives often abandoned them entirely, forcing them to wander as beggars or outcasts, living on the margins of society with no support, no medical care, and no hope of reintegration. The diseased became non-people, stripped of humanity and left to suffer alone. Nothing exposed the complete inadequacy of medieval medicine like the arrival of the Black Death in the 14th century. This pandemic killed an estimated 75 to 200 million people, roughly 30 to 60% of Europe's population. Faced with an invisible enemy they couldn't understand, medieval society descended into chaos, superstition, and desperate attempts at survival. The plague spread with terrifying speed through medieval towns and cities, and nobody understood why. Without knowledge of bacteria or disease transmission, people blamed everything except the real culprit. Some thought it was God's wrath for humanity's sins. Many believed it was caused by bad air or unfavorable planetary alignments. The medical response was tragically ineffective. Doctors wore bizarre, beaked masks filled with aromatic herbs, believing the scents would protect them from bad air. These plague doctors became symbols of death rather than healing. Their appearance often meant your community was doomed. Treatments ranged from useless to harmful. People were told to balance their humors through bloodletting, even as they were dying from disease. Others tried burning aromatic woods and herbs to purify the air. Some physicians recommended bathing in urine or covering the body in excrement. Quarantine was one of the few effective measures, though it was implemented crudely. Entire families were sealed into their homes with infected members, often condemning healthy relatives to death. The psychological impact was devastating. With no understanding of disease transmission and no effective treatments, people lived in constant terror. Some turned to extreme religious practices, believing suffering would earn God's forgiveness. The Black Death revealed the complete failure of medieval medical understanding, but it also demonstrated human resilience in the face of unimaginable horror. As we reach the end of our journey through medieval healthcare, take a moment to consider the people who lived through this era. Every person who survived childhood in medieval times had endured medical practices that would qualify as torture by today's standards. They lived with constant pain, disability, and the knowledge that any injury or illness could be fatal. So, what do you think? Would you be able to endure the same amount of pain in current times? Do let me know in the comments. If you enjoyed the video, please like, share, and subscribe.